Welcome to the LMSW Quickfire Quiz, where every question is a learning opportunity, and every answer brings you one step closer to exam success. Whether you're reviewing for the first time or doing a final brush-up, this session will not only test your knowledge, it'll teach you the why behind every term. Ready? Let's dive into 20 essential questions that cover everything from clinical insight to macro-level impact, and yes, we'll break down why each answer matters. Question 1. What is self-determination? Answer: clients' right to make their own decisions. In social work, honoring self-determination means supporting a client's choices, even when we don't agree with them. Empowerment starts with autonomy. Question 2. What does reframing help a client do? Answer: see their situation from a different, more positive perspective. Reframing shifts the narrative. It helps clients see their problem as a strength in disguise. It's all about perspective. Question 3. What's the main purpose of program evaluation? Answer: to assess if a program is meeting its goals. It's not enough to launch a program. We have to measure if it's actually helping people. That's how we learn, grow, and justify funding. Question 4. What does a coalition do? Answer: brings groups together to work on a shared issue. Coalitions combine voices, resources, and momentum to tackle big issues like homelessness or mental health advocacy. Question 5. What is policy analysis? Answer: studying the origins and impacts of laws or regulations. Understanding how policies are made and who they impact helps social workers push for meaningful systemic change. Question 6. What is countertransference in social work? Answer: when a therapist has emotional reactions to a client based on their own past experiences. Recognizing our own reactions is critical. Countertransference can cloud objectivity and must be addressed through supervision. Question 7. Which term describes when a client projects feelings from past relationships onto the therapist? Answer: transference. Transference can tell us a lot about how a client has been treated in past relationships and give us opportunities for healing. Question 8. What does dual diagnosis refer to? Answer: the co-occurrence of a mental health disorder and a substance use disorder. You can't treat one and ignore the other. Both need to be addressed for full recovery. Question 9. What should a therapist do when they realize they are in a dual relationship? Answer: seek supervision or guidance to manage the relationship ethically. Dual relationships can blur professional boundaries. Getting help ensures you stay ethical and effective. Question 10. Which term describes behavior that aligns with a person's self-perception? Answer: egosyntonic. When a person sees their behavior as acceptable, they're less likely to see it as something that needs to change. Question 11. How is empathy demonstrated in social work? Answer: by showing understanding of a client's emotional experience. Empathy is the bridge between you and your client. It says, I see you, I feel you. You're not alone. Question 12. What is the main goal of the empowerment model? Answer: to help clients realize and use their own strengths. You're not there to fix them. You're there to help them see they've had the tools all along. Question 13. What combines clinical experience, ethics, and research to guide treatment? Answer: evidence-based practice. EBP ensures we are not just doing what feels right, we are redoing what has proven to work. Question 14. Why is informed consent important in social work? Answer: it ensures clients understand and agree to treatment. Informed consent is about trust, transparency, and respecting the client's right to choose. Question 15. Which technique mirrors a client's feelings and words? Answer: reflective listening. Reflective listening validates the client's experience and strengthens the therapeutic relationship. Question 16. What is interpretation in therapy? Answer: a clinical insight about a client's behavior or emotions. Interpretation brings subconscious patterns into awareness, which can be the first step toward transformation. Question 17. When is confrontation appropriate in therapy? Answer: after establishing a trusting relationship. You have to earn the right to challenge otherwise. It can do more harm than good. Question 18. What is the purpose of clarification? Answer: to make vague client statements more understandable. Clarifying isn't correcting, it's making sure we're on the same page before we move forward. Question 19. What's the role of probing questions? Answer: to encourage deeper reflection and exploration by the client. Probing questions can lead to aha moments, but they have to be asked with care and compassion. Question 20. What is community organizing focused on? Answer: empowering people to take action on issues they care about. Social workers don't lead the charge. We walk alongside communities as they rise together. That's it for this episode of the LMSW Quickfire Quiz. Remember, this isn't just test prep. These are tools that'll shape how you show up in the field, in policy spaces, and in people's lives. Until next time, keep studying, keep reflecting, and most of all, keep believing in the power of the work you're doing. You've got this.